I really appreciate everybody coming tonight. We've had a kind of a flu epidemic. Everybody's been sick. My wife's sick tonight, so we appreciate the coming a lot. Tonight is something I'm really excited about. This is, I guess, in the last, it's hard to imagine it'll be 30 years for long as a cardiologist, but this is probably the most exciting thing I've ever talked about. There's new research you can hear tonight that can be life-changing, and we're going to talk about that. But first of all is that tonight we're going to look at Samson's life and draw a correlation to our health, and there's a strong association there, as you'll see in a few minutes. First of all, yes, what if I could ask you if you could turn back the hands of time? In other words, you could roll that clock back. What if I ask you, imagine feeling like you're 20 years old again? What if I said, do you believe you can grow younger as you age? Do you want more strength and energy? You can halt your aging process. Tonight you're going to learn some information that won a Nobel Prize that can really change. It's a big life changer, I call it. This research, as you'll see here, it's a real pretty picture in it. It's a picture of that's a picture of your DNA. Your DNA are the chromosomes that determine your genetic makeup. On the end of those chromosomes, there's a cap there. It's that bright green thing on the end of that chromosome is a green cap. That's called a telomere. That right there is so important because people that have a long telomere can live a long time. People who have short telomeres will die faster. So people that have heart disease, people have cancer, people have bad infections, they have a short telomere. What's exciting about this research is that some scientists say it's the key to immortality, but what it is, we know that's not possible, but the ideal is it's something you can do something about. How many times do you think you'd be able to turn back that clock of aging? Tonight I'm going to present information that can make you a new you. And we have to look at Samson first of all. If you'll get your Bible out, I love the way Jeff says the sword. I like that. And if you look in Judges 14:15, Samson went down to Timnah together with his father and mother. As they approached the vineyards of Timnah, suddenly a lion came roaring toward them. The Spirit of the Lord came upon him in power, so he tore the lion apart with his bare hands. So there's no question that Samson had supernatural strength. Next, in Judges 15:14, as he approached Lehi, the Philistines came toward him shouting. The Spirit of the Lord came upon him in power. The ropes on his arms became like charred flax, and the bindings dropped from his hands. Finding a fresh jawbone on the donkey, he grabbed it and struck down 1,000 men. Can you imagine if you were the Philistines? I was just thinking to myself, I'd hate to, how are you going to stop this guy? He was a one-man fighting army. So Samson had something special. There's no question about it. And he put the fear into the Philistines. But this next thing shows how Samson goes through some things that we go through in our own lives. This slide here is a picture of something that's very important. The key to not aging is maintaining your testosterone and growth hormones. Those two hormones determine if you age. If you can maintain those hormones, you won't age. If you'll notice on this graph, after the age of 30, it starts falling off like an L shape. So past 30, everything starts deteriorating a little bit. So when you're younger than 30 years old, you're like Samson. You have not supernatural strength, but you have a lot of strength. As we age, it falls off gradually. Look what happens when you get to be above 70. That the testosterone level, the average goes below, sometimes as low as 200. So when you're younger than 30, it's really high, but then it drifts all the way down real slowly. But Samson's strength was unique, and it was supernatural as long as his hair was not cut. When his hair was cut, he became just like us. He became like a regular person. And in Judges 13:5, it says that an angel spoke to Samson's mother and said, because you will conceive and give birth to a son, no razor may be used on his head because the boy is a Nazarite, set apart to God from birth, and he will begin the deliverance of Israel from the hands of the Philistines. So as long as his hair wasn't cut, he had tremendous strength. The next slide shows that, unfortunately, as we age, when we lose testosterone and growth hormone, we start losing our muscle. And remember when you're young, you stand up nice, straight, and tall. As you age, how many people have you seen walk around when they start bending over like this? That's because they're becoming frail. The word frail is really important. When a person is said to be frail, they have a higher risk of dying. They have a higher risk for any surgical procedure when they're very frail. So that's all due to loss of muscle. It's not related to your heart getting worse. Just the pure loss of muscle makes you pull over and become more frail. This next graph is emphasizing what I was talking about earlier, is that, you know, growth hormone and testosterone are your key to maintaining your youth. They both fall and rise the same. So in other words, it looks like an L-shaped curve. They both come down. They start out real high, and they both come down to very low as you get older. Tonight, we're going to see how you can actually reverse that process. We can actually make it go up as we get older. This is a study of our veterans at the VA hospital, and the green line is showing what happens when your testosterone gets real low. A low testosterone is associated with a 40% higher death rate, so a 40% increased risk of dying early when your testosterone is low. A low testosterone results in obesity, muscle loss, high blood pressure, insulin resistance, and diabetes. So having a low testosterone is not a good thing. In our new book that's coming out, this book will be free online. It'll be at the end of the month. You can, if you go to jerrybwilliams.com, it goes in a lot of detail about this. But what I talk about in this book, I've never said this before, is that when you become sick, the first thing that happens is you lose muscle. We sometimes don't think about that. We always think about going to the doctor and get a white blood cell count or liver function test. We don't think about the first thing that's happened. We're losing our muscle mass. When you get the flu, think about how weak you are. You know what I mean? You're not dying of a heart attack when you have a flu. You have extreme muscle weakness. So the first thing that happens to all of us, we lose our muscle first. Then what happens when the muscle we lose, we develop what's abdominal obesity. Loss of muscle means a regain of abdominal obesity. And then what happens then, you develop metabolic syndrome. Remember before we talked about that. Remember, obesity does not kill, but metabolic syndrome kills. And metabolic syndrome is abdominal obesity with high blood pressure and diabetes. Those three things account for 80% of our healthcare costs right now. So you see a lot of people who develop the abdominal obesity, and then later on in life, they get multi-organ failure. They end up on a ventilator. They end up on a dialysis. So it's a downhill, like a snowball going down the hill process. But our health is about choices, and I want to kind of talk about that real quickly. In that Samson had a lot of choices in his life, and if we go back to Judges 14:2. You know, Samson, unfortunately, was blinded by desire and lust. That was his biggest problem. In 14:2, he said, I have seen a Philistine woman. Now get her for me as my wife. Samson had great physical strength, but he had no moral strength. He was missing the one important ingredient. He didn't have any moral strength. In Judges 16:4, sometime later he fell in love with a woman in the valley of Sorek whose name was Delilah. So the problem was Samson loved ungodly women. You know, Samson's first wife was not approved by his parents. They begged him to want to marry an Israelite woman, but he wanted to have a Philistine. And then he leaves that one and goes to a prostitute, Delilah. So he was, even though he made a bad choice in those situations. Every day, our body, just like Samson, we have to make choices on our health and our body every day. And remember, your body is aging and slowly dying every day. You can make choices that slow that process down, or you can make a choice that speeds that process up. God lets you choose in regards to your health. I had a lady say, well, Dr. Williams, God is not answering my prayers about losing my weight. He's not going to do that for you. God wants you to sweat. He wants you to have discipline. He's not going to answer your prayers like that. You know, in Hebrews 12:11, in that verse, it's saying in a roundabout way, it says, the pain of discipline brings joy thereafter. You've got to go through the pain first to get the joy. So anything we're doing with our health is that God kind of wants us to, you ever heard the saying, we got to have some skin in the game to be successful, in other words. So you have to have something, you got to be involved. But so many people today are killing themselves with a fork and becoming a couch potato. It's one of the worst things. I wrote a chapter in the book that's coming out about the dangers of inactivity. If y'all get a chance, please read it. It was surprising me when I reviewed the research on that, how when we become inactive. In other words, in some studies, it was as high as risk as smoking. So it was amazing the correlation there. But when I talk about that, I love the story about Naaman. In 2 Kings 5, 1 through 19, I love this story because of it relates to what I see every day, and when you're talking to people about their health and stuff, is that, remember Naaman, he was a captain of the Syrian army. He was one of the king's best soldiers, you know. But unfortunately, his name meant handsome. So Naaman meant handsome. But unfortunately, though, Naaman had leprosy. And we all know that leprosy will disfigure the face. It will destroy his facial features. So the king there gave him money to go down and talk to Elisha the prophet about being cured, about being healed. And I love what happened in this story. So he goes down there. He's a big captain of the Syrian army. And so Elisha didn't even go out to talk to him. He just sent a messenger and said, tell him to wash in the river Jordan 7 times. You know what? He was very disappointed. He said, I'm a captain of the Syrian army. He should give me more respect than that. He should come out here and talk to me personally. And then what I love the most about the story is a picture there. You see the muddy river of the Jordan versus the river of Damascus. I like this a lot because he didn't want to get in the muddy river. He wanted to get in the clean Damascus River. But what you got to remember in relation to your health is God wants you to get muddy. He wants you to get in that muddy water. Always remember that. He wants you to have sweat and discipline. To have real good health, he wants you to get in the muddy water. I want to tell some true stories that happened to me as a cardiologist, and it emphasizes some very good points for all of us. And the first example is shortness of breath and energy after a lady had bypass surgery. She was a 68-year-old female presenting for evaluation of shortness of breath and no energy after bypass. She stated, Dr. Williams, you have not helped me at all. And when she said that, I asked her, I said, what about your chest pain? Oh, my chest pain's better. I don't have to take any nitroglycerin anymore. But that's not the reason I came to see you. I want to be able to have, when I walk, not to have shortness of breath. I want to have energy. And I said, ma'am, I'm sorry I didn't do a good job. I didn't explain it well enough to tell you that stents and heart surgery do not help your energy. They don't help your endurance. You know why? Because that lady had all of her arteries bypassed. She had plenty of blood flow, but when you lose your muscle, you lose your energy. You become very short of breath. So what I did, I talked to her. I said, we're going to turn you around. So I had the well care to start working with her on the exercise program. Now she's increased her muscle mass, and her shortness of breath is starting to get better now. So in other words, she's starting to turn that around. So that shows how loss of muscle can affect you with many things like that, even when you have completely normal blood flow. The next thing is that a lot of people want to have a gimmick to be healthy. You know, a lot of times, I'm glad we got some young people here today that play, a lot of athletes that play ball and stuff, is that we're always trying to find a way to increase muscle mass. You know, it says here, builds lean muscle mass and enhances you. It's never been proven. This is called creatine. And I had a 24-year-old man presented for the evaluation of high blood pressure and kidney dysfunction. When you have high blood pressure at 24 years old, that's not a good thing. And he also had dysfunction of his kidneys. He was taking no drugs, but he was taking this medicine right here, creatine, to enhance his sports performance. What worried me, his exam, he had a blood pressure of 160 over 100. His labs revealed acute kidney dysfunction. So I said, I'm going to get the ultrasound. If the ultrasound shows his heart's normal size, I know whatever's caused this happened acutely. So when he did the ultrasound, his echo of the heart was normal. So I knew right then this had to be due to something that he had recently been involved with. And he finally started telling me he was taking the creatine. So what we did, we stopped the creatine. Within 3 months, his blood pressure came back to normal. His kidney dysfunction corrected. There's never been a controlled trial that's ever proved this is going to turn you into an elite athlete. But tonight, you can do this. We have a way naturally it's been proven to be better than this anyway. And you'll learn more about that in a few minutes. But don't get caught up in any new gimmicks that's going to make you where you're strong anymore. Billions of dollars are wasted on false claims. that are not true. The next case is about whey protein. A lot of the trainers here in the Shoals area, you go to a gym, they start working out with you, and they want to say, I'm going to get you on whey protein. I'm going to increase your muscle mass and get you feeling better. I had a 45-year-old man presented for evaluation of LDL cholesterol of 172. Normal LDL cholesterol is less than 70. So his had went up 70 points after he started taking this whey protein. So I talked to him. I said, look, I said, whey protein is engineered nutrition. This was $27 at Walmart a while ago. I saw Judy a while ago at Walmart. It's $27. This is engineered nutrition. It's never been proven. Everything you do comes with a price. He did lose a little bit of weight, and he did increase a little bit of his muscle mass. He could have done that naturally anyway, but look what he did to his LDL cholesterol. He destroyed his LDL cholesterol, so he increased his risk of having a heart attack. Tonight, I'm going to show you a program that increases the testosterone and growth hormone and lowers the cholesterol. That's what you want. That's the ultimate program, and you're all going to learn that tonight. The next case I'll never will forget is a young guy. He came in the office, and my nurse said, hey, you need to see this guy quick. And I said, well, he's 45? He said, yeah, but I don't care how. I said, well, is he really? He don't look good. When the nurse says he don't look good, you better go check him out. When I got in there, his feet were so swollen that when I mashed on his ankles, that formed a big old crater there. And he couldn't lay down. He was gasping for breath. And I looked up and I saw his neck veins were distended. I knew he was full of fluid. When you see neck veins distension, that means the fluid's backed up in the lungs. You're in trouble. So we put him in the hospital right away. We put him on diuretics to take the fluid off. I put him on some medicine to make his heart better. We did the ultrasound. His heart was only pumping 20%. So I went back and asked him, are you using alcohol? Are you taking cocaine? Oh, I'm not taking anything. And his wife was in the room, and she spoke up and said, Dr. Williams, he's taking anabolic steroids. So I said, uh-oh. I said, well, how'd you get anabolic steroids without a prescription? He said, well, I bought it over the internet from Canada. Remember, when you buy something over the internet from a foreign country, they don't even tell you they don't really know what's in it because it's not investigated by the FDA. Where my wife works as a pharmacist, they come in there and look over their drugs and make sure they're right. But they don't do that over the internet. So anabolic steroids are bad, but there's no telling what was in that drug. But anyway, the good news, he went off of that. He never went back to it, and his heart function now is nearly back to normal. So we're really excited about that. The next thing is that a lot of people come see me. They're taking testosterone pellets because a lot of times they have a loss of energy. They don't feel good, or they may be having marital problems, but they go on testosterone. I had a case of a 50-year-old female present. She was having a tremor, just kind of shaking all over. She was having a tremor. And her exam was normal, except she had a loss of hair on the top of her head. Her echo and Holter were normal. She denied any drug use, but after a question, she said, well, I have been taking testosterone pellets. And I asked her, I said, well, when you get this nervous, is it usually when it's time for your next injection? I said, yeah, how'd you know that? And that's what I usually see is that before the next injection, they start getting symptoms of withdrawal. And I want to show you an important concept about the brain. See, God made the brain very smart. So if you take and inject something in your body, the brain immediately picks up on it, and it makes your body quit producing the hormone naturally. So when you inject yourself with testosterone, you stop producing your testosterone naturally. And when you do that, a lot of times they can develop low energy, less stamina, irritability, and sometimes you can have significant depression. So you have to be very careful. The next thing that happened, I had a patient came to see me, and he was concerned his blood pressure medicines were making him feel bad. He said, I feel like I'm in a fog. And he said, I'm having trouble urinating. I cannot urinate normally. So we started checking him out, and he'd been taking testosterone for a while, and turned out the testosterone had enlarged his prostate. Remember, guys, all of us as we get older, we're going to have trouble with the prostate enlarging. That's pretty common, but you will accelerate the process with testosterone. You will enlarge your prostate dramatically. This guy, unfortunately, had to go on some Flomax and later on Proscar to try to shrink the prostate back down. But that wasn't the end of his story. The reason he was in a fog was he had developed polycythemia. polycythemia is where the red blood cells become too thick. When you give somebody testosterone, it makes you make too many red blood cells. So your blood becomes like sludge, and that's when you're at risk for having a massive stroke. Luckily, he didn't have a stroke. We sent him over, and they took out 2 pints of blood to lower his hematocrit. And the other sad thing about testosterone is that testosterone can cause the increased growth of prostate cancer. Say you have prostate cancer, you don't know it. You start taking testosterone, it's like throwing gasoline on a fire because it'll go crazy. So that's the reason taking testosterone is not a simple thing. As you can see, it has a lot of problems. Tonight, you're going to see where we increase testosterone 4 times above normal with no drugs. And you'll see that in a few minutes. We'll show you. Now, this next concept is critical, y'all. You've got to get this concept. It's going to help you a lot. Is that this was published recently by the Cleveland Clinic. The test your doctor did in order that could save your life is the insulin level. That was the title of the article. And what they're saying is that when you go to see your doctor and he orders a fasting blood sugar, he orders a hemoglobin A1C, remember that an insulin level will go up years before they do. So if you want to pick up you've got a blood sugar problem, you get an insulin level. But more important than that is that you've heard me talk about insulin. In the last book I'd written, we talked about the bad things of when you have a high insulin, right? If your insulin is the major hormone that stores your belly fat, it increases production. Also, when insulin level goes high, it constricts your vessels and makes you have high blood pressure. Also, it will burn out your pancreas and make you have full-blown diabetes. It also causes girls to have polycystic ovarian syndrome and can't have a baby when the insulin level goes high. It also causes dementia. We know how I feel about dementia. My mother died only a few months ago. And dementia has been called diabetic brain because there's a strong association with high insulin levels in that. So it's important, in this case we just talked about, her insulin level was 38, normal was less than 5. So this girl was impressive. She was very motivated. She was exercising every day, 7 days a week, and her blood pressure was getting higher and she couldn't lose any weight. The reason was her insulin level was high. And let me tell you, I want you to think of this like a lock and a key. If your insulin level goes high, it's like insulin locks the key to your cells, and you can't burn the fat. In other words, you can't get the fat out of your cells, so you get severe abdominal obesity. You cannot burn the fat. So in other words, insulin's locked that down. And the other important thing that insulin does, it inhibits your testosterone and growth hormone. So when that happens, it destroys your ability to maintain muscle. You start gaining abdominal obesity. So remember this point. This is the point you got to take home with you. Most people that come in with low testosterone, it's due to a high insulin level. Always remember that. People are given shots immediately. Hey, your testosterone is low. Let's hit you with a shot. Remember, if your insulin level is high, it's going to drive down your testosterone. Please don't forget that. You're going to have to tell your doctor about the insulin level because they don't usually do that. That's just new information. So you got to make sure that you tell them, hey, what if I got a problem with my insulin level being too high? So insulin will shut down your hormones. So what this girl did, we got the good part of the story, we changed what she was doing, her diet and stuff, we got her insulin down, and she started losing her weight. In other words, if your insulin level is high, you can go on a near starvation diet and you will not lose a pound. How many times have you seen people come in and say, I've been on this diet, this diet, this diet, and this diet, and I can't lose weight? They probably have a high insulin level. Remember, you cannot beat your hormones. You cannot physically do it. If you control your hormones, like we're going to show you tonight, you can change the world. But without doing that, you have no chance. You have no chance, y'all. That's the reason all diets have been the greatest failure in medicine, because nobody realized the insulin was a problem. It was inhibiting us the ability to burn our fat. Okay, the next slide is very important because it goes over real quickly that high insulin levels, and I saw Judy Abrams tonight when I was buying this stuff, but it's interesting. I appreciate y'all holding me to the fire. I was in Walmart and I was buying this. A guy said, why are you eating that, Dr. Williams? He came up and asked me that. 2 people did. Then when I was checking out Judy, I saw Judy. So in other words, it's good y'all make me accountable. But anything that's in a package is going to elevate your insulin levels. And we know that processed, fast foods, sugars, breads, grains will all increase your insulin level. But also remember that fruit juices and sports drinks. In other words, eat the fruit, don't drink the fruit. If you eat apple juice and rather than apple, you're going to have a high insulin level. That's going to be a big problem. Next is that I want you to get this concept. Food can be your medicine. I mean, it can be life-saving. You need to eat food that can increase your testosterone and growth hormone naturally. That's what you want to do. That's where the power is. And this food right here is the stuff that does it. And I didn't used to like broccoli and stuff like that, but you have got to taste my wife's broccoli salad. It feels like you've had a congealed Jell-O salad. I don't know how she does it, but it's awesome. And food like that, you can learn to eat it if it tastes good. If food doesn't taste good, you're never going to eat it. But there's a lot of good recipes that can help you. But we ask ourselves, though, why is this better than this? All right. This right here costs $27. How much do you think this costs? $1.40. So why are you paying that much difference? Because this is engineered nutrition. Now, what's the difference? This is God-given food. It doesn't have a package on it, does it? There's no package here. It's not like this. And this right here has 20 ingredients. Sugar, corn syrup, palm corn, cocoa. It's got everything you can imagine that's going to increase your insulin level. This right here doesn't increase your insulin level, but it produces testosterone and growth hormone. That's very powerful. So that's the key, is that we got to be on foods that change us around. And so spinach, kale, lettuce, broccoli, Brussels sprouts, cauliflower, all those things are going to be the foods that increase your testosterone and turn you around. The next thing here is another important point here, is that you need to try to avoid medications that increase your insulin level. We have a true story here. A 69-year-old male changed his diet and started working out with us at 4:20 in the morning. He completely reversed his diabetes and no longer has to take diabetic medicine. So I'm real proud of Donnie Berry tonight because he did it. He got off his diabetic medicine. But you know what? Donnie didn't mind getting in that muddy water. You got to get in that muddy water. That concept is so powerful. You got to get in that gym. He hardly ever misses a day. He's there. He'll be there in the morning at 4:20. He doesn't miss. But he's going to feel so much better. He was on 2 medicines, Donnie was, that increased the insulin level. You say, why would you do that? Well, when you go to the doctor, your blood sugar is high. There's 2 types of diabetics. Let's get this real straight. You've got a type 1 diabetic where they need insulin. Their body's not producing it. A type 2 diabetic, you've got too much insulin. You say, well, why are you going to give me more insulin? Because I'm trying to get the blood sugar down. So what happens is if you're a type 2 diabetic and they put you on any medicine except metformin, you're going to gain weight. Look how much bigger a type 2 diabetic is than a type 1 diabetic. A lot of times the type 1 diabetic will be thin because they need the insulin. They're not producing it. Look at the type 2 diabetics that are obese. That's the power of this. And look what Donnie's done. He's reversed that. Now, real quickly, is that we'll go back to Samson here for a second. I love the way this correlates with our lives. What Samson, it's amazing to me, is that you can obtain renewed strength. And just like Samson's strength returned, let's go back to the Bible here on this. In Judges 16:28 through 30, then Samson prayed to the Lord, O sovereign Lord, remember me. O God, please strengthen me just once more. Then he pushed with all his might, and down came the temple on the rulers and all the people in it. Think about it. The thing that got Samson in trouble was his eyes. Think about it. It's a powerful analogy. But what did he end up? He lost his eyes, the thing that caused him to have all of his problems. But when he lost his eyes, it caused him to lust and have all those desires. But then when he lost his eyes, he's down there and he's plowing that grain like a mule in there grinding corn, and they were making fun of him. He knew God was still in control. So he asked God one more time, and God allowed him to kill 3,000 more Philistines. But yet we're in the same situation. We can obtain renewed strength just like Samson did. And that's what we're here tonight to talk about. This is the program we're here to talk about tonight. And I appreciate you letting me introduce that first part because it was critical. This program is called Sprint 8. It was discovered by a guy named Phil Campbell, just like the city up in Phil Campbell. Before, only elite athletes had this information. People like us never knew about it because when he discovered this, he was working with Usain Bolt. He helped him break the world record. And the people go to the NFL Combine, the picture on the right, he helps them. They pay him thousands of dollars to help them become a faster runner, faster jumper. But we'll be able. But tonight, though, y'all can learn to do it the same thing. So what's good about Sprint 8 program? It causes your body to produce growth hormone and testosterone naturally. It turns your body into a fat-burning machine. And an important thing, it changes your DNA. In other words, that telomere length we talked about, it increases the telomere length so it rolls back your clocks of time. It allows you to not age. And what I like about it, I talked to a group of ladies the other day, it improves your wrinkles. How many people have injected Botox? You don't have to raise your hand, but a lot of people go to get Botox injections. Botox increases the collagen in your skin, and it helps your wrinkles. But this program also improves your wrinkles naturally. When you increase growth hormone and testosterone, you improve your wrinkles. It also reverses metabolic syndrome. It reverses diabetes, high blood pressure, high cholesterol, and it decreases dementia, and it reduces the risk of the dreaded cancer. It does all these. It improves your strength and energy. And one thing I want to tell you that's real important is that how many have had the love handles? Anybody? You don't have to raise your hand, but I used to do 500 sit-ups a day, and I couldn't get rid of the love handles. It's very frustrating. But let me tell you, though, this can do it. This is the first time in my career working out of 40 years that I've ever seen anything that destroys love handles. The problem you have when you go in the gym doing these exercises, you have to buy new gym shorts because they won't hardly stay on you because they do. That's what it does. It chisels the fat off of you. If you're producing your hormones, remember nothing is better than your hormones. If you increase those hormones, you're going to cut that fat tremendously. What about, some people says, well, Dr. Williams, this works for the elite athlete. What about somebody like me? What about the normal people out here? That's what you want. Can this work for normal people? So this guy, Phil Campbell, he went to Brookhaven, Mississippi. So somebody called and asked him, said, why did you go to Brookhaven, Mississippi to do your study? He said, I want to be at the fattest place in the country. He said, if it works there, it's going to work anywhere, right? And you know who he did on the study? You can look this study up. He only did women. The reason he did women is women have less muscle mass, so they don't burn fat as easy. It's hard for them to lose weight. It was all women in the study. They had a BMI above 40, which is most of them weighed above 200 pounds. He told them, said, you can eat anything you want. I just want you to do this for 20 minutes 3 times a week. And look at the results he got. The body fat decreased 27% in 2 months. 27% reduction in body fat because he increased those hormones. If you go out and inject growth hormone, if you're a movie star, you're paying $10,000 a month. Guess how much your fat percentage goes down when you inject growth hormone? Only 15%. So he nearly doubled that. To me, when I saw this information, I said, I'm on this. I'm a part of this. Look how the cholesterol fell, the LDL fell. The growth hormone values went up 603%. So growth hormone went up dramatically. So actually you can change your body completely. So you say, well, how could something be that good? What have I got to do this? It's got to be really complex. It's real simple. Tonight, after we do the invitation, I'll talk more about the physiology of the muscle fibers that cause this. But in simple terms is that we modified what he originally described by using what's called mountain climbers. I don't know if you ever heard of mountains, where you get in a plank position, you take one leg, move to the chest, and move them back and forth like this. You do that for 30 seconds, then you rest for 90 seconds. You do it for 30 seconds and rest for 90 seconds. You try to do 8 intervals. I've never been able to do 8 completely because I have to pace myself when I get to number 6. But what that does, that increases that growth hormone and testosterone tremendously. But somebody might say, well, Dr. Williams, is this safe to do in heart patients? We had a 76-year-old male who, doing this program, his testosterone increased to 866. Now, remember what I said. The average person in the 70s is going to have one of around 200. So his testosterone level went to 866. And what's more important is look at his LDL. His LDL went to 56. Remember the guy that was using this stuff a while ago? His LDL went to 170. So this dropped to 56. So that's what you want. You want a program that increases testosterone and growth hormone. At the same time, it brings your cholesterol down, so you have a low risk of a heart disease. That's the ultimate program. Well, this person is John Blackwell. John, he worked hard though. He's like Donnie. He got in the muddy water. He gets there at 4:20 in the morning. Y'all remember John's situation. He fell and broke his hip. He went in the hospital. He developed pneumonia. He developed a pulmonary embolus, a blood clot. He developed congestive heart failure, and then he had a heart attack. Then he went and had 4-vessel bypass surgery, and then he had a mitral valve replacement. Going through all of that, you think, well, there's no way he could do all this. But the way he was effective in this is that it's like God said, he wants you to sweat. He wants you to have discipline. He's not going to give you a testosterone level of 866. Prayer is not going to do that. He wants you to work hard. So he really worked hard. And so this program has no question lowered his risk for future heart events because of that. So in summary, y'all, is that please get your growth hormone and testosterone naturally. Don't resort to needles, to supplements, and to gimmicks. Please try to get it naturally. And now we're going to give the invitation song. And there may be people here tonight it's been like Samson. We've all made mistakes. We've all fallen by the wayside. If there's someone that needs prayer, we'd like for you to come now as we stand and sing.